Hello, I am Representative Dan Griffey. I'm a lifetime resident of Mason County, husband, father, grandfather, firefighter, and legislator. I have continued to take actions and get results, protecting our elderly and ending the statute of limitations on felony sex crimes. I have continued to take a stand for those who are vulnerable and need assistance. It is not just my job, it's who I am. It has been an honor to have your support, and I am asking for your vote to continue the work we started. We are stronger together. I am Dan Griffey, and I approve this message.
Paid for by Griffey for State House 35th District.
Come November, all medical, dental, and other healthcare professionals will begin following new rules designed to cut misuse and abuse of prescription opioids. The rule changes may affect patients who are prescribed opioids for any reason other than cancer. Washington state health officials conducted a news conference at Governor Jay Inslee's office Monday to get the word out about new state legislation that focuses on improving opioid prescribing and monitoring. State Health Officer Kathy Lofy talks about how the rules will affect patients who use prescribed controlled substances.
Things that patients may notice when they see their provider is, first of all, there may be more conversation about opioids and more questions being asked before opiates are prescribed. There may be shorter prescriptions than people may be used to getting for acute pain conditions. Because, as I mentioned earlier, we are really trying to give that lowest effective dose for the shortest duration of time. For patients who have chronic pain, there have been rules that have been in place for chronic pain since around 2012, and the new rules are very, very similar.
Alden Roberts, a physician who is chairman of the Washington State Medical Commission, explained how the new rules will affect doctors and healthcare providers.
It hasn't reached the majority of providers now, and we expect to have more reaction in the future. However, there are changes. Some of the changes will require are really important, such as you have to be registered. You have to be registered with the prescription monitoring program in this state if you're going to have a license and prescribe Schedule 2 through 5 medications. That's a change for a lot of people. The other change, which is going to be significant, is that surgeons will need to be involved with both the prescription monitoring program as well as the movement between acute pain and subacute pain. And that's actually a critical area in which people can become, they can start using these medications in inappropriate ways.
Jason McGill, Governor Jay Inslee's senior health advisor, says alternatives to prescription opioids will also be encouraged under the new rules.
We're talking about cognitive behavioral therapy, physical therapy, massage, acupuncture, particularly chiropractic care. So we are looking at ways to implement coverage policy accordingly to that evidence. So those would be some other avenues beyond just pharmacy.
State Health Secretary John Weissman called the opioid epidemic in the state a serious problem.
We are all here because the opioid crisis is taking a very heavy toll on the lives of our friends, our family members, and communities, and is devastating across Washington and the nation. There is no single group today that is now untouched by this epidemic. Right here in Washington, in 2016, we had 694 people die from any opioid overdose, and that rose to 739 in 2017. So just stop and think about that. That is more than 2 people dying each and every day in our state from an opioid overdose.
I'm Jeff Chu for iFiber One News.